Hello, everyone, and welcome to Chapter 21, Reproductive Intersex Surgery, Female Genital System, and Maternity Care and Delivery. As I stated earlier, quite a few of these chapters are very short, some 1 day, some are 2 days, some are 3 days, but we're nearing the end of this module. There are 40 days in this module. So we're going to go ahead with announcements first. Remember that on today for 4 p.m., today, Wednesday, 4 p.m., Career Services will have a guest speaker explaining some of the job responsibilities with working online or working from home. So that speaker will be just discussing some views on that. Again, yesterday's Career Services was canceled due to inclement weather. A lot of areas had terrible, terrible weather conditions, so that meeting was canceled and rescheduled today, Wednesday, for 4 p.m. Also, remember on Thursday, every Thursday for 4 p.m. is our Zoom class. Please try to be present for Zoom class. We have Tuesdays. Every Tuesday is our NCCT prep practice exams for your certification exams upon graduation. And every Thursday for 4 p.m. is your Zoom class. So please try to be in attendance. Remember that you need 25 hours of work online. So please try to schedule your 25 hours of work online. So we're going to go ahead and get started with, again, Chapter 21, Reproductive Intersex Surgery, Female Genital Systems, and Maternity Care and Delivery. This is a diagram just showing you on how the genital system for females, the reproductive system, looks. Next, after completing this chapter, you should be able to describe reproductive services, report reproductive services, again, report intersex surgery services, understand the format of the female genital system subsection, identify elements of component coding with female genital system codes, define the critical terms in maternity and delivery services, define services in the global maternity and delivery package, understand the format of the maternity care and delivery subsection services, and demonstrate the ability to code the female genital and maternity care and delivery subsection. Reproductive system procedures. The reproductive system procedures subsection 55920 is located after the male genital system subsection and consists of only one code. Make sure that you highlight this. This will be on your exam for your final exam. The reproductive system procedures subsection 55920 is located after the male genital system subsection and consists of only one code. 55920 reports the placement of needles or catheters into the pelvic organs and or genitalia, except the prostate, for the subsequent interstitial radial element application, brachytherapy. This procedure is performed with the patient anesthetized. The surgeon examines the disease area to determine the areas that require treatment. A template device is inserted into the vagina and positioned over the areas to receive the radial element insertions. The number and depth of the needles or catheters vary depending on the area to be treated, but typically 32 flexi-guide catheters are inserted. This code is not used to report radial element application for the prostate. Remember, it states in the first paragraph, reproductive system procedures, it says the one code except the prostate. So 55920 is the only code that's used except for the prostate. So in the second paragraph, it's stating, this code is not used to report radio element applications for the prostate, which is reported with 55875. So if it's going to be used with the prostate, the code is going to be 55875. Insertion of a vaginal ovoid brachytherapy system is a common type used to treat cervical cancer and is reported with 57155. A hymen capsule indicated in the parenthetical statement following 55920 directs the coder to 58346 when reporting hymen capsule insertion. So it's very important to make sure that you read in the parentheses, the information that is explaining to explain to you where you need to look. The physician would manually insert the capsule into the treatment area, which necessitated the physician being in contact with the radioactive source. The newer methods of brachytherapy are safer as the radio elements are inserted via catheters, thus reducing the exposure of healthcare providers. Intersex surgery. The intersex surgery subsection 55970, 55980 is located before the female genital surgery subsection. Remember, the intersex surgery subsection 55970, 55980 is located before the female genital surgery subsection and contains only two codes. This is in your review questions in the chapter. One for a surgical procedure to change the sex organs of a male into those of a female, and one to change the sex organs of a female into those of a male. These specialized procedures include a series of procedures that take place over an extended period of time. The procedures are performed by physicians who have special skills and training. The procedure for changing male genitalia into female genitalia involves removing the penis, but preserving the nerves and vessels intact. These tissues are used to form a clitoris and a vagina. The urethral opening is shifted to be in the position of that of a female. Some people say clitoris, some say clitoris. The surgical procedure for changing the female genitalia into male genitalia involves a series of procedures that use the genitalia and surrounding skin to form a penis and testicle structures into which prostheses are inserted. Your quick check, 21-1. So if you're going to be watching the video, you can see here, and it tells you how many codes are there in the intersex surgery subsection. And if you were paying attention, and in that first paragraph, it says the intersex surgery subsection 55970, 55980 is located before the female genital surgery subsection and contains only two codes. One for a surgical procedure to change the sex organs of a male into those of a female, and one to change the sex of a female into those of a male. So how many codes are there in the intersex surgery subsection? The answer would be two codes. So please make sure that you're paying attention and you're reading the information so you have a better understanding. And here are some diagrams of the procedures. Next, what is very important to understand in your terminology is medical terminology. You're always going to have medical terminology. So it's very important that you understand the prefix of what it means. So these are some medical terminology, female reproductive, root words, and anatomical terms that you would need to know. Here are some of the pertinent prefixes and suffixes that pertains to the reproductive system. So please make sure that you go over these prefixes so you understand their meanings. It's very important when you're reading the charts, reading the information, that you know what the terms mean, the prefixes. Ante, A-N-T-E, here it is, what it means: before. Dys, D-Y-S, painful, difficult. Endo, within. Hydro, water. Intra, within. Multi, many. So some of these abbreviations have the same meaning. So you have to be careful and understand what those meanings are. You will be tested at the end on medical terminology. So please review this video. Make sure that you're familiar with your prefixes and suffixes. Multi, which means many. Neo, N-E-O, new. Nulli, N-U-L-L-I, none. Peri, around. Primi, first. Secundi, second. So these are just a few that I want you all to become familiar with. By adding in the root words and combining forms, you start to create your own little word babies. If you ever spent any time at the OBGYN office, even as a patient, you will probably recognize many of these familiar related roots. Root word, what it means. Amino, amenion, it's the cephalon, head, cervix, neck, and then so on. So this will be on your screen for you all to review. You will have this video. So I want you all to go through these. These are familiar, and these are common root words that's in this chapter that you would need to become familiar with. Female genital system format. Here is a diagram for you to look closely to be able to point out. You will have a diagram on your exam for you to be able to label. So make sure that you look at the placements. The female genital system subsection 56545 to 58999 is divided according to anatomic site from the vulva up to the ovaries. The anatomic sites are then divided on the basis of a category of procedure. So the procedures, examples: incision, excision, and destruction. Codes for in vitro fertilization are located at the ends of the subsection. Here are the figures. 21A, female genital system. B, the anterior view, female genital system. C, external female genital system. And D, parts of the vulva. So you have here, it's showing you the ovary. Right here is the fallopian tube, the uterus, bladder, and you have the diagram that's showing where it is, the urethra, the vagina, and the rectum. So I have several different diagrams for you all to look at that has the placement. So when you have these diagrams, make sure that you're familiar. You can come back to this video and watch the video to get the placements. Here is another diagram that I have listed for you all to view. Here is another diagram. And here is another diagram for you all to look at. So please watch this video. I will be asking questions related to this video. You will have prefixes, suffixes, and root words. So please become familiar with your lesson. Please review your PowerPoint slides and e-learning. Remember, if you have any questions, any concerns, please feel free to reach out to me. Remember, again, my office hours are Monday through Friday. My office hours are Monday through Thursday, 8 a.m. to 5 p.m. On Fridays, it's 8 a.m. to 4 p.m. I am off on weekends. If you email me on the weekend, I will return your email by Monday morning. But remember, I have 24 hours to respond. So please, if I do not get in touch with you right away, please remember I do have morning meetings and I do have other students that I might be in contact with at that time. Please give me time. I will respond. You can also place information in your comment section. If you need to do a review session or if you want to do a one-on-one, please email me, text, or give me a call. Again, on today, Wednesday, we will have our 4 p.m. career services guest speaker. On Thursday, we will have our every Thursday Zoom class for 4 p.m. On Tuesday, every Tuesday for 2 p.m. is our NCCT certification practice. Enjoy your day. Thank you.